Now is the time for Republicans to seize control of the healthcare narrative. That's the argument our next guest made in a recent op-ed. Sally Pipes is president, CEO, and Thomas W. Smith Fellow in Healthcare Policy at the Pacific Research Institute. Thanks for joining us.
Well, thank you, Mitch. Nice to see you again.
Good to see you as well. And you mentioned in this op-ed that Republicans have a real opportunity to sort of set out a different story on how we should address healthcare issues.
Well, exactly. The Republicans back in early 2017, after Trump had become president and they had control of Congress, they had the chance to repeal and replace Obamacare. But of course, with John McCain, that didn't happen. And now Obamacare was 12 years old on March 23rd of this year. And it's a disaster. It hasn't pushed the cost curve down. It hasn't achieved universal coverage. And the Republicans have got to come up with an agenda that empowers doctors and patients, puts competition and choice out front, so that there's a positive agenda for the voters to sort of attach their vote to. And, it's just, they have to stop being negative and turn to be positive. And I talk about some of the issues, the personal option, expanding health savings accounts, bringing short-term limited duration plans back, not for everybody, but certainly for younger people between jobs. They've been banned in, of course, California, Massachusetts, and New York State, the big blue states. We have to keep expanding on telehealth, scope of practice for nurse practitioners and physicians' assistants, opening up the FDA so accelerated approvals are good and are faster. So it's really time for the Republicans to come forward with their agenda. And, you look at the Bernie Sanders, of course, on May 12th, he reintroduced his single payer bill. He's been pushing this for, I think, his whole life. Probably when he was still in diapers, he wanted single payer. And, the polling shows that 68% of people like single payer when they're asked, would you like free government healthcare? Free healthcare, and the government would provide the very best for everyone. But of course, when you then tell people, well, you'll have to pay much higher taxes, you will probably have waiting lists, and care will be rationed, that support goes down to 36%. It just drops precipitously. And that's because, it's not free. And people don't, when they're asked, well, you're going to lose your private insurance. Well, that's not for me. I want to keep my private insurance. I like it. That's for other people. So it's time, with only 36% supporting what Bernie and AOC and Pramila Jayapal like. It's time, when 64% of people say they want the Republicans to have a positive agenda, it's time to move forward with it, Mitch.
You've already alluded to this, but some of the attitudes have shifted. It's not just a case of people answering once they get more information, but people's actual attitudes about this have shifted, I guess, at least in some respects, because they've seen for the last year and a half how unified democratic government works.
Well, as you know, when Joe Biden was running against Bernie Sanders for that nomination, Sanders was pushing Medicare for all, and Bernie's like, I like employer-based coverage. I'm pushing that public option, which would be a government-based insurance plan to compete against private insurers. And as we know, Biden won the nomination. He campaigned on that issue. He hasn't really moved forward on it. A number of states have, including Washington State, Cascade Care. It's been a disaster. But, the Democrats have sort of controlled the agenda on healthcare. But fortunately, between the American Rescue Plan and Build Back Better, bankrupt America, haven't really, been the successes that Biden and his very progressive members of Congress and the Senate, members of the House and the Senate want. But, it's time, as I say, time for the Republicans to say enough is enough. This is not going to work. And we need to open up the market, not close it down.
You've already mentioned some of the alternatives to this government-based healthcare that Republicans could be talking about, but let's delve a little bit more into detail on them. One of the big ones is health savings accounts. For folks who are not familiar with this, remind us what it is and why this would be such a good reform.
Well, health savings accounts are accounts where you can put money away each month into your health savings account. It's tax-free, and you carry it forward year after year, tax-free. So if you start when you're younger, you carry it forward, and then when you need healthcare dollars, you have them in your account. It also puts people in charge of their healthcare. People that have HSAs are more careful about how they spend their their healthcare dollars. They'll shop around for things, not if you're having a stroke at the moment, but you know, for if you need an MRI or a CT scan or any of those things, you'll be more careful. Right now, you can put away $3,650 a year in an HSA for an individual, $7,300 for a family. I'd like to see those amounts pushed higher so that people can save even more. And we also need to allow people who are on Medicare or Medicare eligible to be able to contribute to HSAs. Right now they can't, but you know, people who are wealthier and have savings, they should be able to contribute to an HSA. I mean, it's just, you know, as I say, it's a way to put people in charge of their health care. And that, I think those are two changes that need to be made for HSAs to make them even better. But they are part of a positive personal option agenda that I really support.
You mentioned those words, personal option, and I was going to ask you about that because those really do set out kind of an interesting contrast to public option, which we've been hearing about from the federal government for a long time. What are some of the other things that should be part of this personal option?
Well, as you know, telehealth, I've been pushing for telehealth for years, and so have people like you. And of course, it took the COVID-19 pandemic to really bring telehealth into the real life. Now, so many people are using telehealth. They like it. You know, it's better for everyone. You don't have to, you know, drive to your doctor's office, sit in a waiting room. You can actually have a personal conversation that's scheduled with your doctor. And if you're in a rural area, it's much more convenient and it's much better. So we're seeing legislation moving forward to expand telehealth so we can have it as a permanent option. I personally, since COVID, I've been doing telehealth visits with my own doctors, and it's really terrific. And it gives doctors more time to spend time with patients who actually need to be seen by a doctor. And so telehealth is a great option that, as I say, it took the pandemic to bring it forward. Scope of practice, you know, a lot of doctors don't like expanding nurse practitioners and physicians assistants to be able to do certain things. They're all NPs and PAs are very well trained. And, you know, this gives doctors, you know, more time to treat the patients that really need treating and let the NPs and PAs do the sort of routine things that don't have to be done by a doctor. We also need to expand direct primary care where it's becoming popular where people can have a monthly amount of money they pay for their direct primary care, and it's going to cut the cost of healthcare. The FDA has always been, it was set up to be, you know, to be an organization for safety, but now it's about efficacy. And the FDA is, you know, really, you know, taking its time on certain things. I mean, it's amazing that the COVID vaccines got through the FDA through emergency use authorization so quickly, and thank goodness. But we really need to let the FDA get rid of some of these barriers and move the process forward, because America is where most of the great treatments and drugs and biologics are developed. We need to expand that. It's a very expensive program. Very few get through, but let's let particularly the new cancer drugs get through so that we can benefit from them.
How important is it, do you think, for conservatives, Republicans on Capitol Hill to adopt some sort of program, including these elements, and not just say, oh, we're going to have a better plan without any specifics, or we're still against Obamacare?
Right. I mean, that's a big problem for the Republicans. They've been so negative. And as I say, they didn't get the repeal and replacement of Obamacare through. Healthcare is very complicated. It's very hard to put your healthcare reforms on an envelope, but it is very, very important. McCarthy has set up, the minority speaker has set up some healthcare task forces for Republicans. And I think it's very important that they get on the program, get with the program, and start pushing these conservative ideas and put them and make them so that the members of Congress, the House members, can understand them so they can educate their own electorate. That is the most important thing that has to be done between now and November, and between now and November 2024, when the next presidential election takes place.
We've been talking primarily about what's happening on Capitol Hill and with Congress, but I have to ask you, as someone who's been following healthcare policy for a long time, North Carolina has been a holdout on the Medicaid expansion that was tied to the Affordable Care Act, but we had a bill that has now cleared our state Senate, has moved over to the House, that would expand Medicaid. As someone who's seen how this has played out in other states, just how bad an idea is this?
Well, it's a terrible idea. One thing that was good in the Affordable Care Act, they weren't able to mandate that every state expand their Medicaid programs. It became up to every state. And I hope that your House in North Carolina does not push this through. The more and more people that get added to Medicaid, we now have over 70 million Americans on Medicaid. The problem is that a lot of doctors don't take Medicaid because the reimbursement rates are so low. And so Medicaid patients have a hard time finding a doctor, or they're on a waiting list for a long time. And so when you looked at the Oregon study that showed people who are uninsured versus people on Medicaid, the outcomes for both groups was about the same. And so I hope that you're not going to adopt this disastrous policy, which of course most states have, and even Republican states have. But I hope that you will be the example in North Carolina of not doing this disastrous thing.
The folks who have been touting this on the Republican side, because we have a Republican legislature, have basically said, the money concerns aren't there anymore for us. Plus, the Biden administration is going to give us this $1 billion plus sweetener to take on the deal. Is that enough, or do they need to look beyond that and see that there's still long-term problems with Medicaid?
There are long-term problems with Medicaid, and they are getting worse as more and more people are on Medicaid. So I think your Republican members need to really understand that this is not going to be a good solution for patients, and it will lead to even greater increases in taxes. As we know, Bernie Sanders' Medicare for All plan has been costed out at about $40 trillion over 10 years, more than double what we spend on healthcare. And of course, it's not free.
Well, that is an issue here in North Carolina, but certainly we've been talking as well about the national issue of Republicans and conservatives needing to get in front of the healthcare narrative and change it from discussion of public option to a discussion of personal option. The author of the recent op-ed talking about this issue is Sally Pipes. She is President, CEO, and Thomas W. Smith Fellow in Healthcare Policy at the Pacific Research Institute. Thanks so much for chatting with us.
Thank you, Mitch, and good luck.